Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Good morning, good afternoon, good evening, everybody. We are back on episode 16 with the Medical Collective, and we are speaking to Dr. Atoosa, our friend. We have a special guest today, so we'll get into that. We're going to speak about everything mental health in our youth. Welcome, Dr. Atoosa. How you been?
Thanks. I've been well. It's so good to be back with the Medical Collective. And honored today to be hosting our special guest, my dear friend from childhood and colleague and collaborator, Dr. Amelia Villagomez, world-renowned pediatric and adolescent psychiatrist, also trained in integrative medicine. Welcome, Dr. Villagomez.
Welcome. How are you?
I'm doing good. Glad to be here and glad to be able to talk about adolescent and child mental health. This is a passion of mine, obviously, because I went into it. It's been the past 25 years studying it, but I'm really excited to be here and have this conversation.
I mean, it's so important. And as a mother of two, let me tell you, it hits home when we are talking about these issues. So I can't wait for the conversation. We always start with a little bit of a news update, but I wanted to do something that is related to mental health. And that was something that's going on. New York Times originally did the investigation, but this is coming from USA Today. And there was a recent investigation alleging that Elon Musk had engaged in extensive use of drugs. Now, what we're talking about specifically is ketamine. He had mentioned on an interview before that, yes, I use ketamine once a week for clinical issues, depression. And now it's going that the use of the ketamine and other things has been more extensive and actually causing some clinical symptoms and maybe affecting his work. We know he was just excused from the White House. So I think that maybe revisiting, as we know that we've also talked about this with Matt Perry, revisiting ketamine use and other things would be good. Let's talk about.
Yeah, I think the question about ketamine is one that is huge because it has really good clinical benefits when used in the right situation for the right purposes. And outside of that, it can be quite dangerous. And so I think with everything, it's not a one size fits all. It's not ketamine should be thrown out. It's more of who should be using ketamine. How can we make sure that there are appropriate safeguards to move forward with the use? Because I think we're first of all, I'm not a specialist using ketamine because I work mostly with children and adolescents, and there's very little data in that area. So it's not very commonly used at this point for children and adolescents and teens. But I do see adults as well. And so, I think what we have good data showing that for treatment-resistant depression, ketamine can be very helpful. But the question remains, for how long can we do it, right? I mean, most of the data and studies are in the short term, not necessarily maintenance studies. And so I think most people would say that ketamine can be a powerful tool, but it has to be accompanied with appropriate psychotherapy. Because when it's used for psychotherapy, from my colleagues who do this, they tell me it really can help shift people to be more open-minded so that the same rigid thought patterns can be molded more easily into more constructive, healthy thought patterns. So I think that when paired appropriately with therapy, it can be extremely effective. But if it's used as the only treatment and it's used for a long period of time, I think that's where we get into trouble, as we've seen in a lot of cases.
And also, you said the only treatment in extended time. I think also excessive use may be an issue. Is that we're seeing
and
with
combination with other drugs.
Exactly.
So in this case, it was combined with drugs of abuse like ecstasy and other drugs. And in children, as a sedation certified pediatrician who worked as a director of a hospital sedation team, ketamine is very well studied in children and adolescents as a substantive hypnotic used in procedural sedation.
Good point.
As in for putting kids into a sedative hypnotic state during a sedation procedure for a painful procedure. In that case, it's studied very well, but as Dr. Villagomez pointed out, not for mental health, right? So I think the problem with ketamine is that it is so easily it so easily slides into that drug of abuse possibility, and it is a street drug in that way as a drug of abuse. So I think that's why the safeguards, the controls, the appropriate medical supervision is so critical.
Very good point. Critical.
Yeah, very good. Well, I'm ready to get into a lot of the conversation that we're going to have today. And while we begin, I think it's important to kind of give some of the stats. And Dr. Villagomez, you had mentioned some of these and given them to me. And I think it's important to understand why we should be so focused on the mental health of our youth and some of the specific things we're going to get into. Suicidal ideation. Very important. I don't think we think about that. We know the completion, but the ideation, there's been an increase, as you mentioned, from 14.4% in 2007 to 22.1%, now. And this is among U.S. high school students, and I have a high school student. Suicidal plans rose from 11.2% to 17.6%, which is very important. Suicidal attempts as well has rose to 10% from 6.9%. And Black youth have had 1.57 times higher odds of suicidal attempts versus their white peers. Pollution as well, we mentioned. What else can be causing mental health issues? Pollution and suicide risk. There have been studies that have shown some type of increase with those that are around areas that are high polluted within 0 to 3 days of high particulate matter exposure. So we'll get into that. And then there was an NIH study as far as our diet, and we know that. I truly believe this, as we also see an increased risk of, increased cancers in our youth. That 67% of caloric intake in kids comes from ultra-processed food. Yep. And then protective role. What can we do to protect? There was a study showing that shared spiritual connection between mother and child decreased youth depression by up to 80%. So those are some of the things that we will get into. But I think one of the things we should start with, Dr. Villarreal and Dr. Atoosa, is to know when to. A lot of parents don't know, when should I take my child to seek professional help mentally, and then when do I go to a therapist versus a psychiatrist?
So I think the first thing about when to worry, right? When do we? Because often what's normal is not healthy too, is what I often say. Because right now we see that 1 in 5 adolescent youth are having thoughts of not wanting to be around. And so, sometimes parents will say, well, this is what's going on with everyone else. It must be normal. And I often say, well, unfortunately, normal is not always healthy right now. So I think there's some general guidelines about when to seek help. But one of the most important, I think, is parental intuition. Right? I'm going to go through all the different symptoms and signs, but if in your gut you're like, this is not my kid anymore, something has changed, I think it's always a good idea to seek help from a mental health clinician. And sometimes that first step might be seeing your pediatrician or connecting with the school counselor. But as far as like, what are the things to worry about? Well, I think, when we're thinking about general, and I'll speak to childhood and adolescence. Well, I'll start with adolescence first. When you're thinking about adolescence, it's like, really kicks in 11 to 12, 13, that kind of age range. And you're thinking between the ages of 12 and 18, this kid has to think about, how do I become independent in 6 years, right? Like, how do I go from needing my mom and dad to do everything to being, hopefully able to have a job, leave house for school or education or something, And in order to do that in the span of 6 years, kids have a developmental schema that they got to think across. And one of my favorite thinkers in this area is Dr. Lisa D'Amour. I love her book. She has also a great podcast. And she describes these kind of 7 stages of transitioning from adolescence to adulthood. And in any of those parts, if you're saying, my kid is not on track, she says these are the areas of when to worry. And this is all really well outlined in her book, Untangled. But I want to talk a little bit about what she talks about in her thinking. So one of the first stages is that these children have to part with childhood. They have to be able to be a little bit more independent from their parent. And so if you see that your kid is clingy all the time and they're unable to do things independently from you, they're wanting you to go everywhere with them. They can't leave the house to hang out with friends. I think that's a time to worry. If you see, one of the biggest things I'll often ask about is, do they have friends, right? Do they have a pack? Because during adolescence is when they shift from the parent as the center of the world to, my friends are really a big reference point of what I'm thinking and believing and all of these things. And if you don't have a pack, you're left to loneliness. Right. And we know that loneliness is very similar in its negative health outcomes to cigarette smoking. I mean, loneliness is a huge predictor of both mental and physical health. So if that adolescent can't join a pack, if they're not having friends, I think that's one of the biggest times to worry. And then the next question is, what kind of friends are they hanging around, right? If you see that there's a lot of substance use going on, if you see that there's a lot of negative thinking, dark thought, lots of work, a lot of parents will come in and say, my daughter's best friend was suicidal and cutting, and now my child is having those kind of thoughts. I think that's another time to worry, when there's contagion, and then beyond that, how are they? It's very common for teens to be temperamental and to maybe push back to push back against their parents, right? And to say, I don't want anything from that. I always say they're kind of allergic to their parents' advice. And so that can be normal. But if they're allergic to all the advice of all authority figures, that would be another time to worry, because then they're not going to be able to get that input. If they're like, I don't like what the cheer coach says, and the football coach doesn't know what he's talking about, and my teachers all hate me, and if there's no authority figure to transition from the parent to the somebody else having a positive impact in their life, and them trusting that authority figure, I would say that's another big time to worry.
So I have another question, really quickly, when we're looking at symptoms when to worry. What about, like, for you too, Dr. Atoosa, when physical symptoms may signify something you need to be concerned about?
Yeah,
what about that as well?
Intense fatigue can be a hallmark of depression, and I always do a PHQ-9, which is a questionnaire, a depression screen, when fatigue is a symptom. And also, as an allergy specialist, headaches can be another one, or just feeling like they don't enjoy their normal activities. I mean, these can be something that often a pediatrician is the first person to hear that there's been a change in that behavior of that child.
Or excessive weight loss or weight gain.
Weight gain and weight loss can both be signs of depression. And then avoidance, like avoiding school, can be anxiety or depression, like not wanting to go to the activities expected of them, whether it is their school activities or their after school activities that they initially showed enthusiasm for. So those are red flags that I look for. And often when I see that there may be physical or physiological signs, that's when I refer to psychiatry alongside psychotherapy. So that's how I view that. But maybe Dr. Villagomez has some input with respect to that. Like, if there are physical or physiologic symptoms, is that a better time to seek a psychiatrist's assistance? And if it's a purely mental or experiential or social symptom, is that okay to just go to a psychotherapist, because they are often more accessible than psychiatrists? Like, it's a shorter wait time.
Yeah. And I think this would be a good time then to divide what exactly is a psychiatrist versus a therapist, so people can understand that.
That's a great point.
Mm-hmm. Well, that's a good question.
It's up to you, Dr. Amelia.
There's so many good things to talk about. Dr. First of all, I just wanted to comment, I think when we're talking, like Dr. Kourosh mentioned, or Dr. Atoosa mentioned, that there's so many different symptoms that you outlined around depression, right? Like weight loss, fatigue, like just more slow in their movement, or restless, agitation. And, when we think about depression, we often think about low mood. That's how it shows up in adults typically. But with adolescents, it's much more common that one of the main symptoms of depression is irritability.
Anger.
And anger. And so that's what makes it difficult, because some parents are saying to me, is this normal teenage angst, or should I be worried? And I think that's when it really comes down to, how is this teen functioning in the world, right? Because irritability can be normal, but not every day, all day to all people, right? Not to their, it might happen with their parents, but not to their friends or to their coaches or their teachers. And so I think that's where we have to kind of tease things apart. Now, and I think anxiety is probably even more common than depression in adolescence. So, and then taking a step back, you also mentioned, what's the difference between the therapist and the psychiatrist, and allied mental health professionals too, right? Because we also have nurse practitioners who can prescribe medication as well. And so I guess the big delineation between the therapist and the psychiatrist is, psychiatrists attend medical school, and we also attend residency. So medical school, so first college for 4 years, then medical school for 4 years, then residency for 4 years. And then if you want to focus on children and adolescents, an additional 2 years. And so with that training, we learn how to differentiate between what could be medical related versus what is more psychological, and what the interplay between both of them are, because often it's a bi-directional relationship. We learn what kinds of treatment are recommended for various types of disorders. So, for example, if a patient has OCD, that's going to be a different type of treatment versus somebody who has generalized anxiety disorder. Or if somebody is picking at their skin or pulling out their hair, that's going to be a different treatment versus depression. And so I think when we're not sure what the diagnosis is this ADHD with a little bit of anxiety, or is this depression, or is this an eating disorder? If we're not really clear where we're at, I think that's when it's really helpful to see a psychiatrist.
And only psychiatrists can give medicine, right?
Correct. Yes, so psychiatrists certainly can give medications, and allied health professionals like nurse practitioners can also prescribe medication. But
I think people get confused. I think people get confused and think that you only go to the psychiatrist to get medicine if you need medicine. Not that you can speak to them, not that they can give you guidance, any of that.
Yes, and I think that you're right. That's a very common misconception, that psychiatrists are a pill mill, or you only go there if you're really crazy. You see a psychiatrist if it's really bad, and so you don't want to go there, but you're willing to get health coaching or something like that. I think that there is stigma around that, which is unfortunate. But, if the analogy is often given, if you had a kid with elevated blood sugars, you'd go see the endocrinologist or your pediatrician, right? And so if you're having a kid who's struggling in a mental health perspective, you'd see a psychiatrist to figure out, what are we dealing with? What are we talking about? But I think so I think if symptoms are complex, if they're not clear diagnosis-wise, if the pediatrician isn't sure what's going on, right? Because I think pediatricians are often really well equipped to be able to figure out, where are we in, a little bit off with normal development, see a therapist, talk about things, see how much things get better, and then get back on track. Versus when is this, concerning enough that I'm not sure what the diagnosis is, and we need clarification on what type of modality needs to be treated, whether medications need to be considered, or other supplements. There's not just medications that can help with mental health. There are various things that have been studied, such as omega-3s, magnesium, vitamin D, amongst others that we know can be helpful for mental health. So when somebody comes in to see me, it's not just a question of meds, yes or no. It's a question of, what is the totality of what's going on here? What's the family thinking is the next step? What do I think is the next step? Where do those two intersect? And what is a plausible next step?
That's great. Explain that. So then the therapist, to me, it wouldn't be an either or.
Correct.
You're kind of alluding to that, right? So then when would the therapist come into play?
As soon as possible.
I think it would be you in addition to the psychiatrist for treatment.
Absolutely. And there's also psychologists, PhD psychologists who can make diagnoses, right? And so sometimes if a diagnosis is not clear, you can also see a psychologist or get psychoeducational or neuropsychiatric or testing done, which often, unfortunately, is not covered by insurance. So that's a big barrier there. But PhDs can often make the diagnosis as well. And as far as therapists, there's many different kinds of credentialing for therapists. There can be a licensed clinical social worker. There can be marriage therapists. There can be various different types of levels of therapy, or therapists who can perform therapy. So I think that finding somebody who does the right kind of therapy is what's the most important, because there are so many kinds of therapy. There's like an acronym soup. There's CBT, which is cognitive behavioral therapy. There's DBT, which is dialectical behavioral therapy. There's ERP, which is exposure response prevention. There's MBCT. They go on and on and on. And if you're going to do the work of therapy, you want to make sure you're working with the right person who's understanding the right set of symptoms and giving the right treatment plan.
And that's where a psychiatrist can advise you. So
there you go.
Again, if you're already seeing a therapist and you're not seeing progress, that's a good reason to escalate to a psychiatrist for further advice, maybe another referral. And after 20 years in pediatrics, I have a fair idea of what kind of therapist to send someone to, but there's also the therapeutic bond. So that can be very different between different personalities and different people. And so I always tell people that just because you went to a therapist once doesn't mean that you have to keep going to that therapist for, the entire duration of treatment. And I often tell people to try out the therapist. If there's a good therapeutic relationship, continue. If there's not, to look for another therapeutic relationship, because I think it's so important. If there isn't that therapeutic bond, no matter how well trained that therapist is, that the relationship is not going to be a benefit to the patient.
That is such a good point. There's actually studies to show that independent of the modality is the relationship.
Yep. Yeah.
And I often say therapists are like a pair of shoes. Okay. You gotta wear them for a little bit and see how they work. Okay. You can't go to a therapist one time and say, I hate this, right? Because typically, if you wear a pair of shoes, the very first time you wear them, they don't feel very good, right? And then on the flip side of it, sometimes they can feel comfortable. You can be wearing them for a little bit, and then you're like, you know what? That really bothers me right here, right?
It's not good for your feet.
Even not if they good seem for comfy.
Me. Yeah, you need a little more support in the arch or something, right?
Right. And so sometimes what can happen in therapy is the therapist becomes your friend. You just come and you chat about your day, and you're like, yeah, this is great. But then you're like, are we making progress here? So it's like a pair of shoes.
That's it. Before we go to the next part, there's one thing I wanted to ask you, because we mentioned a lot of the things about when to seek a therapist or psychiatrist, the warning signs. But what about when you want to prepare or maybe get a therapist or a psychiatrist before something gets bad? So, for instance, a major event. A lot of children were hearing about in the middle of a school, and then there's a mass shooting, right? They lose a parent or something. What about those times? Should the parent be going to you, Dr. Atoosa, or seeking out Dr. Amelia? Or maybe they already have a history of something and they want to nip it in the bud before something happens.
Yeah, that's a really good point. And I think yes to all of those things. I think telling your pediatrician about major life events, and seeking out psychiatry if you have a pre-existing mental health condition, seeking out a consultation during that, even if you're stable at that point or have not needed much support. Major life events can destabilize, and then preemptively getting grief counseling and trauma counseling in situations where there's been a major traumatic event is always a great idea.
I'd like to add to that there's a little nuance to this. Because there was a study looking at what was called critical incident stress debriefing. And basically after an event, they made people talk about what was going on, how you're doing. And you know what? They actually showed that it wasn't helpful. And in some cases, it could
Was this in a group setting though? Or was this one-on-one?
I believe this was one-on-one. And I think I'm not sure of the answer to that question. But I could, but there was there wasn't a significant benefit. However, I think you bring up a good point. about what can be helpful. Because just because this one type of therapy didn't show it wasn't helpful doesn't mean all types of therapies can't be helpful. And I think this is where there's some interesting data through the Center for Mind-Body Medicine. And this is an area where I was trained and certified, is to have groups where people come together and they learn skills. They don't necessarily are forced to talk about what just happened, but they learn skills around mindfulness, around healthy movement, around mindful eating, meditation, art therapy. And it's a 8 to 12 week program where you go through and you learn all these skills. And then as things come up, you then you then share it in the group as you're ready to, not as you're forced to. And then hearing what somebody else is going through helps you know that you're not alone and that you're not by yourself and that you're not weird for feeling this way. So I think it's really important the kind of therapy that you're getting when something like this happens. But what we do know that what can really help people after a traumatic event is structure and consistency. To still try to maintain the routines, to have one-on-one time. If this is if your child witnessed a very traumatic thing, to be able to have that one-on-one time with them, to be in nature, to check in, but not force, and to really follow the lead of the child. Because, what can be traumatic for one person doesn't necessarily mean it's traumatic for somebody else, because it's all the lens in which we see it. There's an analogy that says earthquakes happen at the fault lines. So if somebody had kind of a pre-existing feeling of I'm not safe in the world, and something bad is going to happen, and then something bad happens, then that's much more traumatic than somebody who might believe, you know what, my role in life is to help others, and I'm a helper, and that's where I get my meaning and purpose. And so when something bad happens, I have faith and trust that I can be there for others. And then you can actually see, a post-traumatic resilience rather than trauma.
Great point.
So I think the lens is really important.
Great point. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Okay, so I want to get into something about stigma and health literacy for mental health. Because first of all, adults, we already have enough problem with the stigma around seeking mental health services. And so for youth, we see even more of a stigma. They know they need help, but should they seek it because they know they may get teased for it, they don't want to share that information. So do you think that mental health literacy or understanding it more may help them kind of break that barrier?
I think that's a tricky question, because I would actually say they're all tricky. This is like, in our field, it's all gray. But I would say currently, that youth typically have less stigma of reaching out for help and treatment than adults do. And I would say in part, whether that's good or bad, I'm not quite sure on average, but TikTok and Instagram. I mean, people are constantly talking about their own mental health struggles. And I think it's good because it brings it into the conversation. But I think where it can get tricky is that sometimes, people can start to develop symptoms or think that their problems are larger than they are because they want to fit into this specific culture. So I think that's where it gets tricky. For example, I remember that on TikTok, there was this, I forget who it was, but there was, I think, a famous person who had tics and was talking about it on TikTok. And then there was just people would post on their tics. And then I had the largest number of patients presenting that I've ever seen with tics. And we called it TikTok-induced tic disorder, and the treatment was stop watching TikTok. And so I think that this is where it's tricky, is that you want people to know enough to know how to reach out for help, But when a person has a symptom, especially because adolescents are so sensitive to wanting to be a part of the greater conversation, wanting to fit in. And if they're trying to fit in a place where, it's a negative place, then I think that's where where people are only talking about these dark things and their experiences and then I think it gets tricky. So I think we have to be careful how we titrate, but at the same time, to have that mental health literacy. And I think that many schools are adopting various programs. I think that's a healthy place to bring it up, where
that's a great...
people are talking about this with an adult in the room versus completely, unsupervised online where anybody can post anything. So this is where I'd say it depends.
Well, we know screen time negatively correlates with mental health as it is. And especially if the screen time is encouraging some kind of abnormality within. So, but we know that that's one of the toxins, right? Like we talked about toxic things to our mental health and our environment. Screen time is one of them. So, and Dr. Villagomez and I have talked about this.
Oof, yes.
Yeah, it is. It can be a very negative deterrent. But Dr. Atoosa, when patients come to you, maybe I know you do allergy immunology, but when patients come to the pediatrician, can that also be a time to educate them on, the services? So say you do a study and you find out that there may be depression. Maybe educating them on this is what this could be. These are your options. This is where you can seek help.
Yeah, I do that in both allergy visits and pediatrician visits because there's actually been good studies, and a couple of them I was co-authored in the past couple of years that showed a correlation between severe allergic disease and mental health decompensation. So the coexistence of both anxiety and depression with severe allergic disease was a thing. Part of that is because sleep was compromised. The ability to breathe normally was compromised, and then the intense discomfort, especially itch-related disorders like eczema and other things that cause and hives that cause constant itching, they were really negatively correlated with both with mental health, so leading to both more depression and more anxiety. And patients have literally told me if they feel the itch of the hive coming on, it almost triggers a panic attack because they think they're going to have a full-blown episode of the hives. And then there's the whole anxiety around food allergy, like kids with food allergy being worried about being exposed to their allergen in the wild. And it's actually a real thing that kids with food allergies get bullied more. And they get bullied about their food allergies and get threatened to have allergy exposure by their bullies. So literally life-threatening food allergy exposure is the threat that the bullies bring to those children. And so there's a lot of mental health in allergy as well, where I have to bring it up and I have to bring up the effects. And of course, I educate around seeking mental health care, I do mind-body practices. I'm a certified yoga therapist, and I do mind-body practice education right there in the allergy visit or in the pediatric visit. And then I work closely with mental health practitioners, like with Dr. Villagomez and with 2 therapy groups in my immediate area that I refer to. One of them does EMDR. The other one focuses on resilience-based cognitive behavioral therapy with adolescents. So I do a lot of referrals to mental health practitioners and psychiatrists in our area. So yes, definitely a doctor's visit should be a place. And a general pediatric visit usually includes some component of mental health screening, whether it's a questionnaire or in a well visit, the HEADS history is what we call it, where we talk about depressive symptoms, how things are going in school, at home, drugs of abuse and, substance, alcohol, sexual interactions, friend groups. We talk about all of those things with adolescents, usually with their parents outside the room so that they can feel more comfortable discussing those things. But that should be a part of well care for children, honestly. So, and sometimes that comes up and kids feel comfortable talking about it, but honestly, that again depends on rapport. Like if it's a pediatrician that they've seen once a year ago or 2 years ago when they were 8 years old, and now they're 10 or 11, you're asking those questions, they may not be forthcoming, right? So it's about rapport and about the bond between the provider, the physician, and the child as well.
Right. So I guess I've learned that there's a fine line to go. We do need to educate. The doctor's office is a great place to do that. Community programs, school programs are a great place. But when it comes to social media, we got to be sure we're not getting into a thing where it happens with us, right? When we went through medical school, we see all these symptoms. All of a sudden we have everything. And I'm a pathologist, you guys. So imagine how many things I'm wondering if I have. So let's tout that line very finely. But I'm glad that there's resources for us. Protective strategies, I think, is important. So for our youth and for adults, we finally have realized if we needed help or we need to seek therapy. But what can we do at home or in our lives to kind of promote positive mental health, especially in our youth? Because I'm trying to figure that out right now. You know, I think as a parent, you don't want to be a helicopter. You're also going through a period where they're becoming independent. And you don't want to promote, I want to promote positive body image for my daughter. I want to promote all these things, but I don't want to be too overbearing.
That is a tricky one. And that's a challenging one. As far as so the question is, what are the preventative things that we can do to help with encouraging good mental health? And I think there are a couple of things. One of the medical literature consistently demonstrates that the quality of the parent-child relationship is one of the strongest predictors of mental health outcomes in adolescence and adulthood.
Wow.
So I think that you know, one of the strategies is to have family dinner. I know that sounds so basic, right? Like we have all these fancy things like ketamine and TMS and medications and all of these things, but one of the best things we can do to prevent mental health issues is talking with our kids and going out to play with them and being interested in what they have to say. You know, I saw a meme that said, you know, when your 4-year-old comes to you and shows you their 20th picture of a star, you know, you still take the moment to look at it because for them, that's a big deal, not a small deal. And if you see that as a small nuisance, then when something is a big deal to them and is a big deal to you too, they're not going to come and show it to you. Right. So I think that from a young age, taking interest in our kid, thinking about how do we really help this child. And I think one of the things we can do is to see our children as independent beings and not an object. I think this is where it can be really a struggle, is to not objectify our kids and just see them as a little me walking around, you know, to be able to see that they have their own passions and goals and dreams in life. And when we objectify our kids, that can develop all sorts of personality disorders, all different kind of difficulties. And so I think that spending time with our children, being curious about what they are experiencing rather than pretending or thinking we have the answer to all of their problems, because the reality is we are living in a very different time than when we ourselves grew up. And so I think approaching our children with this stance of warmth and structure is one of the things that we have consistently seen in the literature can predict positive health outcomes, both mental and physical, for our children. So warmth and consistency and structure. I think those are key. And quality dinner, even better if it can be a dinner with less processed foods, you know? Like, I think even though we, you know, when I read that study a few years ago looking at pollution, it was a little bit overwhelming to me that, you know, the study that showed on days where there were high particulate matter or high amounts of pollution in the air, there was a significant increase in completed suicides and ER visits for suicide attempts.
Wow.
And when you read something like that, you realize how we are really connected to our earth, and we have to be good stewards of our earth. And as a parent, sometimes I get overwhelmed thinking about the microplastics and the artificial dyes in our food and the ultra-processed foods and all of these things. And so it is overwhelming. And then I have to keep coming back to the quality of the parent-child relationship is one of the strongest predictors of mental health. And you know, what can I do to help support that along with, you know, all the other things?
And may I make a suggestion? I've actually seen
that's
Amelia
the foundation
do this very well, and that is to be fully present with your children. So I've seen her interact with her children, and she's very fully present with them. She understands what they're trying to say to her. She has a conversation with them as they are independent human beings, but I think I hate to be a broken record here with that anachronistic reference, but again, screen time. Okay. And this time I'm talking about parental screen time, not just child screen time. So there's lots of studies on parental distractibility, like you're in your phone and you're with your kid, you're spending quality time with your kid, but you're not present with your child. And children have expressed that they feel that their parent is not present, that their parent is in their media, in their phone, in their computer, and not present with them. And that this is adversely affects child mental health, to feel that they're competing with media for their parents' attention. And it drives them to the tablet instead of their parent. So that parent-child interaction depends on presence and real connection. And that, again, as wonderful as the technologies that we have are, and I am not a Luddite that is speaking against technology, but against the appropriate use, against the inappropriate use of technology, or the inappropriate invasion of technology into our personal interactions. And while parents will tell me that like texting or sharing Instagram with their child actually is another level of connection, and I don't want them to take away that, there is no substitute for the in-person interaction, for speaking with each other or just being together, being mindful, being in nature together without media. And I honestly, when parents are struggling with the relationship with their child and they're talking to me about the behavioral issues with their children, in addition to sending them to specialists in mental health, in addition to looking for physiologic reasons for those behavior differences or behavior changes, like sleep disorders, like obstructive sleep apnea, like vitamin and mineral deficiencies, all of those things that I look for alongside everything else, I talk about screen time and parent-child interaction with full presence, and the power, the healing power of a calm, engaged presence cannot be underestimated. And whether that is a parent or a loving adult, it can make a dramatic difference in a child's life.
That's good. I think that's like the foundation of how to promote these healthy lives. And I think as a parent, it also tells us that we need to focus on ourselves first. We always say what we're telling and nagging our children, but what are we living? So we're getting our sleep hygiene, which is something else we can do to promote. If we're eating right, if we have social connections that are healthy, if we have a spiritual attachment, the children are going to see that. Because I used to nag with my you. Yeah, they're watching. I used to nag with my son about his health, and then when he started to become interested in girls, then all of a sudden, everything I said, now he's trying to tell me, I'm like, now you're trying to tell me I am doing all this. So they do listen and learn. They may not take it in right away, but I think it's important when we're talking about promoting these relationships with our children, that we're also promoting them with ourselves, and we're doing the things so they can see that, yes, I need to get better sleep. I need to eat better. I need to go to church, or whatever your spiritual connection is. Journaling, all of those things that help with stress management. If they see us doing them, they'll be more likely to do it.
You would not believe what a difference it makes for a child to see a happy, healthy parent who is taking care of themselves. What a stress it takes off of that child, because people don't realize how much stress and anxiety they transfer to their children when they are not taking care of themselves. So that is such a great point, Dr. Keisha.
100%.
Right. When my daughter and my son see me like doing dance or working out, they know, they actually like it. Oh, aren't you supposed to be doing dance class right now? Aren't you supposed to? So they try to remind me, listen, please go do that for yourself. So those are good. Are there any other things you can think? Because I think this has been a great discussion. I know we need to do a part 2 because, yes, environment, there are a lot of exposures and things that we could talk about with mental health and mental illnesses. But I think this is a good ending point for today's conversation to end on ways that what we can do. It's your call to action, everyone that's listening.
Yeah, and I think shared social and spiritual engagement with the family. Like the family dinner was one of the things that Amelia brought up, but you talked about how, your family goes to church together. My family certainly did a lot of service together. Amelia and I both come from the Baha'i faith, the Baha'i tradition, and our family's deeply engaged in social and community service all our lives. And this was such a meaningful bond between me and my parents, is the service work, the volunteer work. And that it was inspired by these spiritual beliefs. I think that was so important. And I think that is important, but even if it's just a mindfulness practice or just a community service practice, it doesn't have to be an organized thing. And you don't even have to share exactly the same spiritual beliefs with your child. My friend is struggling with this. She's like, my child was very happy to go to, religious and spiritual activities with me, and now she's 12 years old and says she doesn't believe in God. I'm like, okay, that's okay if she's struggling with her faith or struggling or finding her own thought process. Does she believe in community service? So I said, keep engaging with community service, keep engaging with yoga and meditation with your child, because these are things that you've done with your child for years. Yeah.
Right. So things may change as far as what they believe in, but don't think that that's a sign that they are having an issue. They're finding themselves. I think that's great.
So Amelia can speak to that as well, whether that's normal.
So Dr. Fowler, he talked about the stages of spiritual growth, just like we know about cognitive growth through the years. He actually talked about the spiritual growth that happens. And he coined the term the 12-year-old atheist. And he said that that's actually a process that you go through, because
a developmental stage.
Exactly. Thanks for those words. Developmental stage. He said, when we're younger, our thinking is it's very concrete, right? Good things happen to good people. Bad things happen to bad people. That's kind of the way the brain understands the world, very concrete. But then as you get older, you start to see, oh, wait, sometimes bad things happen to good people. So how could a just God that you guys have been telling me about, how could that be true? There must not be God if this black and white thinking isn't working for me anymore.
That's incredible.
And so that is going to take some spiritual growth and movement, but that can be a very normal place for a 12-year-old, a 13-year-old, to move, even a 40-year-old. But it's very well documented in these younger teens where they're shifting to more abstract thinking, but they're not there yet. And I think
encouraging curiosity versus retaliating or feeling disappointed, I think is critical in that stage, right, Amelia?
100%. Trying to understand where people are coming from versus jumping in and fixing the problem. Because when you jump in to fix the problem, you teach the child, you can't fix your problems, you need me to fix them, right? Yeah. And so a lot of parents will come and say, I want my child to have more self-esteem. Well, maybe stop fixing their problems. Just the presence you talked about, Dr. Atoosa, is so powerful. Sometimes we underestimate the power of just being present with our children. I think about how many times I have a computer problem and I can't fix it. And then my husband who fixes computers, I'll say, hey, can you come fix it? And I'll show him, I'll say, I tried this, and this, and it didn't work. And then as soon as I just think of another solution when he's there, it was that simple that
he helped you.
He helped me even though he didn't. He's like, why'd you call me? You didn't ask me for any help. You figured it out yourself. But I think we are social beings. We are wired for social connection. And sometimes our presence is enough. And so I think this is especially true with teens, is they don't need us to fix their problems. They need us to bear witness to their problems. And, on that second point about spirituality, I wanted to comment on, because I think so much of our literature sometimes can feel like doom and gloom. Trauma increases depression, and spanking increases depression and anxiety in youth, and social media increases depression, and so does ultra-processed foods. And we know another factor is maternal depression and anxiety, and paternal, like having this family history. And so sometimes I'm going through my patient interview and I'm writing down all the risk factors, and I'm thinking, oh my goodness, how is this person going to move in the world? And then I stumbled across this literature. Lisa Miller, she wrote the book Awakened Brain. And she talks about the protective effects of spirituality. And one of the studies that she referenced is that the child, when both the mother and the child were high in spirituality, the child was 80% protected against depression, compared to mothers and children who were not concordant for spirituality, or mother and children who were not high in spirituality. So in other words, a child was 5 times less likely to be depressed when the spiritual life was shared with the mother. And I presume this is similar with father, but this is how the study was done. And I think this is important because this protective factor was greater than the risk associated with a maternal depression. And then the other thing is adolescents with a strong personal spirituality were 30% less likely to experience clinical depression, and adolescents with strong personal spirituality were 40 to 80% less likely to develop substance dependence or abuse. So I think to Dr. Atoosa's point, it's not about saying you need to be in this faith, or we're not, recommending a specific religious practice, but how do we help our teens connect to something greater than themselves? Whether that's through nature, whether that's through service, whether that's the connection through God or the divine. How do we help them tap into this thing that's greater than themselves? When they're in the process of figuring out who I am, because we don't figure out who we are by sitting in a room by ourselves.
Or on TikTok.
Although meditation helps. Or TikTok.
Meditation helps. But we're not by ourselves there.
That's true. We're communing with the spirit, right? So one of the things you alluded to, Dr. Villagomez, that I wanted to highlight is that one of the protective factors is don't hit your children. So that is literally, there's 80 years of research behind this. I'm not speaking just on a personal belief or a religious belief, although it is the religious belief of my faith. But it is a directive to parents to not hit or vilify their children. But it is so critical, and I think this is correlated with strong discipline in communities of color, immigrant communities, and actually anywhere in the South. I feel like physical punishment of children is just accepted as if you are not doing it, you're sparing the rod and spoiling the child, right? So that is there's some biblical reference that's pulled out about it. But I think that the critical thing to understand is that shapes the perception of the child as violence is an appropriate reaction if someone does something you don't like. And it also says the parent is not an absolutely safe person, because I am not physically safe with the parent. So I think those two things are really critical. And I know there's a lot of psychiatric research to back this up as well. If Dr. Villagomez, you want to talk about that.
So I was really surprised when I read the research that spanking and corporal punishment increases or has been associated. This is not necessarily causal. We don't have that data, but it's associated with a higher risk for psychosis, like schizophrenia, a higher risk for bipolar disorder, and more severe and acute episodes, and also for depression and anxiety. But I think it weaves deeply into the child's psyche when there is corporal punishment. And I think going back to I'm certainly not a biblical scholar, but some parents have shared with me that the verse that you were referring to, spare the rod,
spoil the child.
Spoil the child. Thank you. Is that the rod was used to guide, right? It wasn't used to hit. That rod is used to guide, and I think that's where it comes back to is like, how can we help guide our children with this rod of structure, consistency, warmth? And then we don't need to smack them over the head with it, right? Like it's a matter of guiding these children, because children are the most precious treasure a community can inherit, and they are the guarantee of our future. And any community that neglects the spiritual, physical, emotional education of children will have its consequences.
Well said. I guess that's a great way to conclude this. I think that's important. So we also, parents, need to recognize how we could be contributing, right, to the issues that are going on with our children, and how can we be present with them and the signs and symptoms to look for. But I definitely think we need a part 2 with you, Dr. Amelia, at some point. And I appreciate you coming on.
We should talk about breaking generational cycles and mental health in families. I think there's so much more to discuss. But thank you, Dr. Keisha, for hosting.
Pleasure to be here.
Thank you.
Thanks for bringing mental awareness to the radar. One more place. The more we speak up, the more we bring these conversations up, I think the healthier our whole society will be.
So true. And Dr. Amelia, is there any place that people could find you? And I'll make sure in the show notes, everybody, that you'll be able to find this information and resources as well.
Yes, I work in Fort Worth, Texas, and our practice is called Mindful.
Mindful, everyone, in Fort Worth, Texas. And Dr. Atoosa, your information is always in the show notes, and you guys can find out more about her and her practice. So thank you all for being here. It was a pleasure on this beautiful Sunday afternoon, June 1st. I hope to see you all soon. Take care.
Thank you so much.
Thank you.
Thank you.
Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.